Hello, my name is Gabriela Cueva and I'm going to talk about home use of an artificial beta cell in type 1 diabetes. The artificial beta cell or closed-loop insulin delivery system expanded the concept of sensor-responding insulin delivery. The closed-loop system differs from conventional pump therapy and threshold suspend approaches in that it uses a control algorithm that autonomously and continuously increasing and decreasing the subcutaneous delivery of insulin on the basis of real-time sensor glucose levels. Some investigations have shown improved glucose control and a reduced risk of hypoglycemia. Application in medicine. The artificial beta cell uses a control algorithm to independently monitor and increase or decrease insulin delivery based on real-time sensory of glucose levels. In contrast, insulin pumps that link insulin delivery to sensors that continuously monitor glucose levels can only temporarily suspend insulin delivery based on present glucose thresholds. These systems can decrease the risk of hypoglycemia but cannot respond to hyperglycemia. More constant glucose values were observed with the closed-loop systems than with the control therapy, despite high day-to-day variability in insulin requirements.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Pre-diabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Pre-diabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induce glucose intake. Type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
Pros and cons. Pros. The advantage of a closed-loop system is the responsive, graduated modulation of insulin delivery, both below and above the present pump regimen, which allows for improvement in the proportion of time spent in target glucose range and lowering of the mean glucose level without increasing the risk of hypoglycemia. It will be very useful for patients while they sleep or play sports and prove useful for home use. Cons. 3 severe episodes of hypoglycemia happened with the artificial beta cells, or when the system was not in use because of low battery or the system was not turned on. Artificial beta cell technology is still fairly new, and the feasibility, safety, and efficacy of its prolonged use in the home setting have not been well established.
Well, this could be the biggest advance in decades in the treatment of type 1 diabetes, a disease that affects 3 million Americans. Today, researchers said they have developed a way to get diabetics to produce their own insulin using stem cells. Here's Dr. John LeBout.
When I wake up in the morning, I immediately check my sugar.
13-year-old Finn Darty uses a blood sugar monitor and insulin pump, both attached to his body to keep his glucose in check. Darty was diagnosed with type 1 diabetes when he was 2 years old.
Pretty much my earliest memories have been with diabetes, and so I don't really know any other way.
Scientist Doug Melton knows exactly what Finn's life is like. Both of Melton's children, now in their 20s, have type 1 diabetes. He's devoted his career to using stem cells to find a cure. His research out today is a leap forward.
The idea itself isn't so complicated, but the practice of it turned out to be difficult. It took us more than 15 years to reach the goal that we recently achieved.
In type 1 diabetes, the immune system attacks and destroys the insulin-producing cells of the pancreas. Melton's team turned human stem cells into insulin-producing cells in the lab and transferred them into diabetic mice. The cells functioned like healthy ones, regulating the mice's sugar with no need for insulin injections. 6 months later, their blood sugar was still under control.
What's now very important to know is how will they behave inside a person.
So a little bit of light.
Melton will be working to test the treatment in humans as soon as possible.
It's fun to think about a day when people won't be using syringes or insulin pumps anymore, that they'll have a natural mechanism of their body's own cells making the insulin they need.
Melton says human trials are several years away. One reason this approach is so promising is that insulin-producing cells are better at finely regulating blood sugar than insulin injections and should help patients avoid complications like low blood sugar.
A lot of medical news today. John, thank you for it.
Age of blood in Ecuador. Diabetes is an increasingly common disease in Ecuador. There are 2 types, 1 and 2. Type 1 affects more children and young people. It is linked to a genetic factor that develops at an early age, and type 2 is the most common in the country and affects mostly adults. Of 100 diabetes in Ecuador, 2% are type 1 and type 2 is 98%. The type 1 is prediabetes, which is reversible and controllable, but if not detected and treated in time, it becomes irreversible diabetes. If the blood glucose exceeds 126, it confirms diabetes, which is treated with oral medication and insulin. The most used in the treatment of type 1 diabetes is insulin. The insulin pumps are also used in our country, but in a lower percentage because their implementation and maintenance is economically high. Lantus is usually a given slow-acting insulin, which lasts for 22 hours. At the time to eat breakfast, lunch, and snack, you need to manage a fast-acting insulin called Homelec. This insulin is given to the patient before every big meal to not shoot in high sugar levels. The minimum must use test strips 3 times to know the level of glucose patient blood.
When name is Dewan Kelsey, and I'm a nurse practitioner with Well Life, a diabetes clinic and educational resource center located in Raleigh, North Carolina. And today we want to talk about how to live with type 1 diabetes. Most type 1 diabetes, again, are kids. And so they are taught at an early age how to manage their diabetes. So all of their lives they are taught what to eat, how much to eat, portion control, how to carb count. So it becomes a lifestyle for them. One way that we have really engaged our type 1 diabetics, and I will say our type 2 diabetics, is with the insulin pump. Insulin pump therapy has allowed diabetics to truly live a normal and a healthy life because they are able to manage their blood sugars a lot better without giving themselves like manual insulin shots. The pump works by infusion of insulin in 24 hours. So it starts from midnight to midnight. And the patient gets a slow release of insulin, which we call the basal insulin. Now during meal times, we know that the blood sugar is going to peak, the blood sugar is going to go up, and that's with everybody. So they are able to go into their pump. They're able to tell the pump, I am eating 60 grams of carbs and my blood sugar is 180, and the pump will relay a number to them which suggests this is how much the pump wants to give them in order to bring the blood sugar down. And so it's a really proactive way of lowering the blood sugar. So it really helps to maintain a healthy blood sugar throughout the day. Diabetes is a very complex disease. This has just been basic information regarding diabetes. Please be sure to visit your medical provider for more information or for diagnosis of diabetes.
This is my family. This is my dad. This is my mom. This is me. This is David. And this is our dog, Slinky. He's very funny. He's 36 years old. My brother, he's 5 years old. Sometimes we do little fun handshakes. We go like this. Like that.
You see, Vanessa is just your typical 8-year-old little girl. Just kind of has a little bit of a tomboy in her, which is really cool. We can see nothing but positive words for her. She likes to explore, very curious.
She likes to make things pretty.
Fearless.
Creative.
Fast.
Smart.
Devious. Silly, childlike, cute, extremely cute.
She's a total daddy's girl. So this was my first child. She never cried. We could take her anywhere. I mean, just the perfect baby. So much so that we got pregnant with David. That's when she started exhibiting symptoms. It wasn't until after we got David that she got really sick and she was admitted into the hospital where she was diagnosed.
Our daughter was diagnosed with type 1 diabetes. It became pretty stressful at that time.
So I was sleep deprived because of a newborn, and then I was sleep deprived because I was checking her in the middle of the night as well.
I clean my finger, I grab my needle thing, and then I poke myself.
She knows what to do. She gets her meter out. She checks herself in class.
And I push the blood into the little strip. Diabetes is like a medical condition that some people have, and sometimes kids.
One of my concerns is that she can dose herself and make a mistake.
My concern is more of the sickness itself. There's still risk factors that can still happen. I haven't forgotten about those, and I hope they don't happen. I hope there's a way that it doesn't happen. But that's always going to be sticking around, and that's still stressful. But I feel a little bit more comfortable because of the pump and all the medicine around. A lot of people know what to do if something goes wrong.
195.
Correct. The pump has made a great difference in her life, and it'll automatically dispense the insulin, so it's a lot more discreet.
And And the older she's getting, the more she knows how to use it.
If I were to meet a family with a newly diagnosed child with type 1, I would say just hang in there. It gets easier. It just becomes second nature. It's not easy, but it will come. And just keep at it.
I like to do all sorts of stuff. I like to read, I like to play.
She likes to draw things, clay things, all kinds of stuff like that.
I made a penguin and it flapped its wings. This is a parrot. I made an octopus. Here's the baby bird. He came out of his egg 3 weeks ago. Here's our dog, Slinky. I decided that when I grow up, I'll be a landscaper.
I've never heard a kid her age really interested in that. When I take her biking, look at that, we always look for any kind of art.
But it's really a landscaper job that I visualize in my grandma's house. Right here I'm standing in front of my grandma's house. Over here there'd be a pond, a small one, with a river leading up to here. After it gets to here, the water would come all the way to here, and there'd be a big pond right here with an apple tree on the side, a little bench, and there's supposed to be a little bush there.
As long as she maintains and checks herself, she can lead a normal life.
I think it's a real improvement for what it is right now.
She can do it in the future. And she's starting to realize that.
I can go anywhere now. I can even sleep over at my Thea's house, even though she's in Sacramento. Come on, David. Let's go.
Diabetes mellitus is a metabolic disorder caused by the inability of the pancreas to produce enough insulin for the body, or when the body fails to use insulin properly. Insulin is the hormone responsible for regulating the body's blood sugar level. If insulin is insufficient or is not used effectively, blood sugar increases. This condition is called hyperglycemia. Hyperglycemia commonly occurs with uncontrolled diabetes and can lead to damage to the eyes, kidneys, nerves and blood vessels. An acute, severe disruption of the blood sugar level can be fatal. The types of diabetes are type 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes is also known as insulin-dependent or childhood-onset diabetes. It is a condition wherein there is inadequate insulin produced in the body. Type 2 diabetes, on the other hand, is also called non-insulin-dependent or adult-onset diabetes. This type of diabetes is brought by the body's failure to use insulin effectively. Gestational diabetes is characterized by hyperglycemia that occurs initially during pregnancy. The cause of type 1 diabetes can be abnormal genes in the body, and there is no available information about prevention. Type 2 diabetes, on the other hand, is the product of an unhealthy lifestyle and is related to excessive body weight, unhealthy food selection, and prolonged inactivity. The cause of gestational diabetes is linked to the effect of fluctuating hormones of pregnancy on the body. Symptoms of diabetes can be frequent and excessive urination, extreme feeling of thirst, weight loss, vision changes, itching, and fatigue. Treatment of type 1 diabetes requires administration of insulin on a daily basis. Type 2 diabetes and gestational diabetes treatment involves proper diet, exercise, oral medication and insulin in some cases. In both types of diabetes, non-smoking is essential to prevent damage due to diabetes. Type 2 diabetes can be prevented through living a healthy lifestyle that includes attaining and sustaining a healthy body weight, being physically fit and active, and eating a well-balanced and healthy meal. Your general practitioner can give you more information about the disorder and its possible treatments.